Welcome to our channel. Dr. Praveen Gupta presents Oncology Nursing Conclave 2026.
Thank you, organizer, for inviting me. My task is to motivate our nursing staff. I just want to tell you that we are proud of our nursing staff, and nursing staff is vital for any hospital, any healthcare in any country, for any country, because they provide direct 24 into 7 care to patient. They administer drugs, they collaborate with the healthcare team, doctors, and they counsel and they provide emotional support to the patient and their attendant. Brachytherapy means treatment of cancer by radioactive source, sealed radioactive source, and the source, precise placement of this radioactive source into the tumor or near the tumor. Most common source of brachytherapy is iridium-192, and the most common indication of brachytherapy is carcinoma cervix, and other indication are endometrium, sometimes breast, head neck cancer, and skin cancer, and sometimes prostate cancer. These are the images from our brachytherapy. Part of brachytherapy. These are applicators. This is brachytherapy machine. This is where we place the applicators per vagina, intravaginal, at the cervix, and these are the channels. This is how we place the applicators into the cervix. Before procedure, nursing staff has critical and important role to schedule the patient and collaborate and communicate the appointment and scheduling of the patient to doctors and other healthcare team, anesthetists, OT staff, and medical physicist team and physician. Other important thing is informed consent. It is a legal process. While it promotes the trust between doctors and patient, we have to inform about the procedure, health, the benefit and the risk of the procedure to the patient. And then we are the witness, we have to take signature of the patient and their relatives on the, and document it that we have informed, we have explained about the procedure to before doing the procedure, because it's an important legal process. Another thing is, nursing staff is the first line of defense. They have to explain and a lot of queries of the patient's attendant to calm the anxiety and the stress about the process, about the of the patient and relatives. Nursing staff has to take care of OT equipment. OT is sterilized. All equipment, all instruments are sterilized. And before taking the patient, again they have to check about the pregnancy, about the allergy, about the, any particular thing like loose teeth, which is important before the procedure. We have to be ready for any emergency during the procedure. Crash cart maintenance is the very critical part of the nursing role, because we have to ensure that our crash cart is always available, it is accessible, it is a mobile emergency, mobile team for the emergency. We have to be ready with all drugs. We have to check all the medication, all the equipment like defibrillator, oxygen tank is full or not, because we have an emergency can come at any time. We have to check our equipment in the OT like oxygen, portable monitor, intubation part, pulse oximetry, cardiac monitor, respirator, and these sterile instrument, equipment, all sponge part, all dressing part, and important part that our all equipment and applicators should be ready and they are sterilized, like tandem, needles, fiducial markers, and fixation device. Nursing staff, nurses play important critical role and they assist to radiation oncologists during applicator placement. They guide us about the length, about the type of applicator, and about the procedure. They assist and they guide the other healthcare team how can we reduce the time of application and how easily we can do the procedure. After procedure, this is nursing staff responsibilities for safe transportation and ensure that the OT is sterile and clean for the next application. And they have to watch on the if bleeding, there is bleeding or any other complication of the procedure is there. After procedure, patient will first inform to nursing staff about the pain or any other complication like nausea. Nursing staff has to watch on the blood pressure and other they have to monitor vital signs. After procedure, nursing staff will play important role in nursing the discharge. They will explain what complication patient can see, patient can expect after the discharge at their home, like pain, nausea, vomiting, bleeding, and what diet and what other precaution they have to take at their home. Another important part of the nursing is educate other healthcare team about OT protocols, sterile technique, surgical asepsis, and radiation protection. Radiation protection and radiation safety is very critical in brachytherapy and radiation department to protect ourselves and patient from radiation hazard. So I want to thank you all. Nursing staff is very important for administering drug, to collaborate and counseling of the patient, and counseling and the communication with radiation oncologists and other team of hospital. Thank you. We are proud of you.
Thanks for attention. For more educational content, subscribe the channel.